HHS is a massive organization. Secretary Robert F. Kennedy Jr. announced he's going to be slashing 10,000 workers. And remember, 10,000 already got buyouts. So he's going to be cut down about 25%. How does he do it and make sure that people get what they need? The secretary joins us now. Bobby, it's good to have you.
Good to be with you, Chris.
You know, I haven't even talked to you on TV. I've talked to you off TV, but congratulations. It was an interesting process to watch. Since you've been in, what is the biggest surprise for you so far?
I think the biggest surprise for me was the warm reception that I got from HHS employees. The day that I was inaugurated, I had one of the biggest crowds in the Great Hall, and it was without exception very, very supportive and very warm. I think people at HHS want to do their jobs. They want to make America healthy again, and they feel that they're finally going to be able to do their jobs.
So how do you reconcile their enthusiasm with word of 10,000 cuts?
Well, you know, there's cuts across the federal government, and I think it's hard on everybody. But our agency, which is the biggest agency in government, twice the size of the Pentagon, $1.9 trillion, grew by 38% budget during the Biden administration, 17% in employee increases, and public health went down. By every metric by which you measure public health, it decreased with all the money that was being thrown at it, with all the personnel that were being brought in. This is a sprawling agency, Chris. We have over 100 comms departments. We have 40 procurement departments. We have dozens of IT departments, dozens of HR departments. None of them talk to each other. And what we're trying to do now is to streamline the agency, to eliminate the redundancies, and to focus the mission so that everybody who is at HHS is going to wake up every morning and say, what am I going to do today to make America healthy again? And we're going to make it easier for those. We're not cutting scientists. We're not cutting frontline workers. We're cutting administrators, and we're consolidating the agency to make it more efficient.
So you have to bear the burden of some of the DOGE rhetoric and recoil. So when people hear cuts now, they worry about delivery of services because there's an open question as to whether or not at least Elon Musk cares about any of the people who get served by these agencies. So when it comes to your agency, Bobby, which, as you said, is a sprawling one, how do you give confidence to all of the individuals and parents and families that need the services that you provide and they hear they're going to be cuts?
We're not going to cut services. We're not going to cut Medicaid. We're not going to cut Medicare. We're going to continue. We're going to provide services, but more efficiently. We have, thanks to Elon, and by the way, what Elon did with our agency is going to help our agency. So I'm very grateful to him he came in for the first time with a real org chart for the agency. The agency org chart, when I arrived, was incomprehensible. There was no chain of command. There were people operating in all these different silos and fiefdoms, and they were so territorial and so self-serving that they were selling patient information to each other. So I tried to get the CMS patient information, which belongs to the American people and belongs to HHS. And the sub-agencies said we have to buy it from them. And it doesn't make any sense. There are sub-agencies that refuse to give us patient data. This is depersonalized data. And we need to make America healthy again. What Elon is doing is he's using AI to improve health, to improve efficiency, to improve delivery. And he had a bunch of geniuses come over to the department, create an org chart that worked, and consolidate. We have many divisions that are doing the exact same thing. We need to consolidate them and give them a sense of mission, to invite them to participate in making our country healthier again. And I think that's why we're getting, a very, very strong, enthusiastic reaction from people within the agency. And of course, it's hard to lose workers. We're going from 82,000 workers to 62,000. That's tough on everybody. But I think in the long run, we're going to have much greater morale in a demoralized agency.
Hey, thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget, click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.